Hello, everyone, and welcome to the room number 8. Let me introduce Professor Catalina Gonzalez Uribe. She's the director of the Office of International Affairs at UniAndes. She holds a PhD in epidemiology and public health from University College London. And she holds also 2 master's degrees, one in social epidemiology and another one in anthropology. Catalina is also a professor at the Faculty of Medicine and leads the design of the postgraduate epidemiology curriculum. Furthermore, she works in qualitative and quantitative research in different health projects. So she's going to explain now a little bit more about the project, and in the end we will have some time for questions. So Catalina, please go ahead. I'm gonna stop sharing my screen.
Thank you, Carolina. Welcome, everybody. Very nice to meet you. I can see that we have 11 participants. I'm just wondering if I should, the question I had before, should I speak in Spanish or in English? I don't want to exclude anybody. I will be sharing information both in English and Spanish on my screen. And I will also provide you with the links. Caro, if you could share the link of the web page. I will be sharing the screen, but also you can check our web page. Thank you, everybody, for coming, for joining us. This is a fantastic opportunity. We were very much looking forward to see who showed up and if we had a good audience, and I can tell that we do. So I want to share with you a little bit about our project. We have this summary made specially for this matchmaking event. And we have our website where you can visit us anytime. We will be updating information. We have our webpage in Spanish, but by the end of the week, we should have the English version. And I'll be, for now, sharing my screen with the English version, as I know we have people from across the continent, so it's important to do so for now. Any questions? Thank you. We'll have some time. We'll have enough time to listen to everybody. And if you have something that you'd like to ask and you don't want to forget, I suggest you write it down in the chat, and that way we can come back to that. So thank you, Caro, for the introduction. This is a very large project. It is actually like 5 projects that have come together within one big program that started last year. At the beginning of the pandemic, the IDRC from Canada opened a call around May or June, and they wanted a response from the Global South to think about countries where information could be transferable and comparable when you wanted to think about good alternatives and the use of evidence in decision-making regarding COVID and health-related issues, all the collateral damage that we can see COVID has brought to our lives, although there are also positive things that we're also studying. So we got together a group of about 8 faculty members from Universidad de los Andes. We had been working together since March, trying to provide information through the university's website of what was happening, trying to describe how the pandemic was behaving and how we were experiencing things in Colombia. So we thought this would be a great opportunity to put everything that we had learned as while we were collaborating online. This group of professors, we've never met physically on campus. We've only been in contact online, and we wrote down in about 2 or 3 weeks this proposal, and the IDRC received more than 150 proposals, and 6 were selected. So I'm very happy to share this with you, and we hope CALEV can be a house for many of you, can be a place to learn, to share, and to practice all sorts of different skills and what you've been learning through your own discipline choices. So we actually, CLEV is a team, and our acronym, we wanted to catch the idea of Colombia and evidence, because this is what the call was bringing to our attention. We are a large group from very different interdisciplinary backgrounds, all from Universidad de los Andes, and we seek to produce and communicate evidence that is interesting, that facilitates the dialogue between academia and decision makers. In academia, we're used to producing a lot of information, but not necessarily in a timely manner and in a clear way. And so this is a school for us as well as researchers. How can we communicate better, more thoroughly, and provide a message that can potentially benefit, a very large group of people and have a positive impact? And that is a challenge for academia, is a challenge for us who want to have an impact, but sometimes are very complicated with our words, or we just work on very complex things, and we need to put this down for a larger audience. We need to be able to translate that information in an interesting and creative way. So this is the challenge that we have ahead. But when we think about evidence comes in very different colors and shapes and flavors. And we are also facing what the World Health Organization has named in Spanish infodemia. We also have a lot of information going on. We have misinformation, we have fake news, we have the media providing information, plus academia. We have the YouTubers, the Twitter, Facebook. And sometimes it's just very confusing. And this is the context that we have and the challenge. And we thought of 5 working groups to think around this. How can we provide good evidence? But how can we also understand the nature of evidence and of the information that is shared every day through so many channels, and filter somehow and share this with decision makers? And decision makers are not only politicians. Many of us can be decision makers. We are decision makers in our everyday lives, but also through the places that we are, where we participate, where we work, where we study. We're making decisions all the time. So what I want to share about this is that we have 5 groups where we have faculty members from Universidad de los Andes, where we have postdoctoral students, other graduate students, and where we will be very happy to host many of you to inquire along with us, through the questions that we have and new questions. So the first group, the one I'm showing here with my mouse on the left, called Decisions and Data. We think it's also very appropriate to try to understand what we understand as evidence, how we use evidence. Do we really use the evidence or the information available to make decisions, or do we toss coins? How do we make these decisions? How do decision makers proceed, and what information they use? How is it useful for them or not? We have a group of qualitative researchers, and this team is led by Simon Turner, one of our faculty professors at the School of Management. And they've been talking and interviewing and conducting focus groups with stakeholders across Colombia. And we want to be able to draw the architecture of the health system in Colombia and to understand how decisions are being made and how it has changed compared to the time before pandemics, especially because AI, artificial intelligence, and mathematical modeling, statistical models are playing a key role for the pandemic. We've had these models before, but we haven't really used them in the decision making as as much as we are right now. And this is a key thing. So that is one place where we can see, hear about other questions and receive input from you. The second group is a group of engineers, biologists, statisticians who are conducting the mathematical models. So they gather information from across Colombia, and they've compared also with other Latin American countries. And we try to understand the development of COVID, how the virus is behaving, the number of cases that we have, mortality, how long each peak is taking place, why is the third peak taking so long in Colombia, how can we use this information, for example, through the school system to help schools open, to provide them with different scenarios, depending on the epidemiological characteristics in the country, vaccination rates, and so forth. So that's the second group. The third group is interested in the logistics. How is COVID-19 having an effect on the logistics when we think about health services provision? And they're focusing currently on, right now, on the logistics regarding vaccination schemes for COVID-19 across Colombia, based on the regulation that the Colombian government is providing. We have a dashboard with this information, and it's different compared to the national dashboards because we have logistic indicators. So anybody interested in health service provision, from an engineer perspective, from management perspective, logistics, this would be a great opportunity to understand what's going on with the health ecosystem, how it is responding. We've also studied ICU occupation in large cities in Colombia and massive transportation systems, and how could we think of better ways of designing the way we allocate the services and how they're distributed within the cities. The fourth group is studying the social, the public discourse in digital media. We're currently focusing on just two, Twitter and Facebook. Why this two? Facebook is very important and interesting. Almost 70% of the Colombian population, and I'm sure this is a figure comparable across other countries from people who are right now in the room. So 70% of the Colombian population have a Facebook account and are using it. So a lot of what's discussed there has a very large audience. Whereas Twitter, for example, the audience is no bigger than 15%, but the quality of the conversation and who participates there has a very strong influence when it comes to political decision making. So we're studying the trends week by week. We've developed AI models to understand the conversation, to identify keywords, to see how it is changing, and we're developing a network to try to see how people communicate, how they influence, how topics change, when comparing different months across. And the last group, they describe themselves as a group that wants to provide disruptive communication strategies. They want to do something different. And their first project is already online, and you can check that on the webpage. I'll show you very briefly. They have the Dis and Misinformation Museum, and they've collected information for key examples of misinformation in Colombia, month by month since March last year. And this is currently under study. And we want to use this as an intervention tool with schools in large and medium-sized cities in Colombia. And it would be fantastic to be able to replicate this in other countries. We already have the algorithms for the search. We have definitions for this type of misinformation, fake news, and so on. So we have a glossary of words around this, and we have a time frame to compare, to reach out, and we want to see how youth responds to this, how children respond to this, as being a key element of how decision making is affected. So that's a summary of the 5 projects. I can tell there's been some people writing things, so I'll get with you in just 2 minutes. Up here, I just wanted to describe a little bit that we have some cross-cutting issues of the study. So each team is a big group and they have their own focus, but we need to have a conversation, you know, across all 5 groups. And we have some key issues that we've highlighted and where we're working on them. And that will probably, we might have to add a couple 2 issues in the year that still remains for CLEF. So this is a 2-year funded program. So we're modeling back to classrooms, we're understanding decision making around that, misinformation around that, vaccines and vaccination. We have very big interest on mental health issues, and that area is still under, you know, development. So we have a lot of room there for improvement, for participating, for collaboration. And we have the need to provide information that goes beyond averages, because averages hide realities within our country, especially in Latin America with so much inequality. So we have a differential approach. We want to look at vulnerable communities that are not represented through our data, through statistics. How can we correct that? What can we do differently? And we also have a gender approach that is currently under development. So these are the cross-cutting issues that I wanted to share. These are audiences, decision makers in public health, and this is just a description of the profiles of our team, to really emphasize that this is an open invitation to, you know, all of you from very different disciplines. Even though we say COVID, this is not a medically or clinically focused project. We're looking for interdisciplinary approaches. Caro, this is what I wanted to share. I'm happy to move on with questions so that we have enough time to chat, for people to discuss, and I'm happy to take them in Spanish or English, of course. And this is the webpage while you let me know, or if people raise hands. So our homepage, if you need our presentation, the one that I showed in Spanish is right here, where it says presentación. We have events coming up, description of our 5 lines of work, and well, we're still working on this. We're building up the page, so very happy to take any comments right now. I'll stop sharing for now to be able to see you all.
Does anybody have some questions for Catalina? Like, this is the moment, because you are sharing this space with her, so please go ahead.
Puede ser en español, obviamente. Sabemos que hay colegas brasileros, so that's why we spoke in English. We weren't sure what to do. Para motivarlos in Spanish. We will be using the forms survey online thing. Caro, I don't know if you have it, if you have the link. The organizers have produced this Microsoft Forms, and we're very happy to use that so that you can apply and get in touch with us. I have a list also of, with the contact details of some of you, and we will be emailing everybody, as Camilo mentioned. But this is the right time for you to introduce yourselves if you have any questions, if you think that you might have an interest or something that you'd like to share.
Buenas tardes. ¿Me escuchan?
Perfecto, sí, adelante.
¿Cómo está, doctora Catalina? Mi background es economía. Estoy terminando una maestría en economía computacional, entonces a mí me interesó bastante el tema de usar inteligencia artificial para el análisis de texto. Creo que usted hablaba de Twitter y de Facebook. Entonces no sé cómo estaría, si mi background ayuda para este proyecto. No le entendí muy bien lo de las etapas, porque usted dice que es un proyecto de 2 años, entonces... ¿depende del background? ¿Es por el periodo de tiempo en el que tú te incluyes en el proyecto o cómo funciona eso? Gracias.
Claro, Cristian, no. El proyecto dura 2 años en total, ya llevamos trabajando varios meses y no varía según el background como el periodo que puedas participar. La verdad, estamos pensando en que sea una experiencia para el segundo semestre académico del año, del presente año. Y como estamos ensayando y estamos aprendiendo, estamos absolutamente dispuestos y flexibles a también acomodarnos a las necesidades del estudiante, ¿sí? Entonces, si hay unos que tienen 4 meses, otros 6 meses, creo que eso depende mucho de los calendarios académicos de sus universidades. Tu perfil, como mencionaba antes, es perfecto. Y con gusto incluso podemos agendar como unas salas pequeñas de reunión. Tenemos, diría yo, que 2 equipos trabajando en análisis de texto. El grupo 4 que mencioné, que está haciendo el tema de Twitter y de Facebook. Pero el grupo 5 que mira lo de misinformation, ellos también hacen un análisis de texto y están construyendo una base de datos de noticias falsas. Y eso requiere mucho análisis de texto también. I'll just translate this into English because I'm sure maybe some of you will find useful the information that I provided to Christian. He's asking if depending on the background, we have a different length of opportunity for the internship. I'm just saying, no, it's the same for everybody, and that we're very happy to accommodate ourselves. The project can accommodate to the time available for each student. We know the academic calendar varies in each university, so we can adapt, we can set up a plan. And he was asking, he has an economics background, and you're interested in AI algorithms for text identification. So I mentioned group number 4, working on the Twitter and Facebook analysis is a good match, but also group number 5, because they are creating a database of examples of misinformation. And the idea is to build a very large database. It would be great to have something that goes beyond Colombia. AI is an area with lots of development, but especially in English. When it comes to Spanish, we have a lot to develop. So all the algorithms that we run, Facebook, Twitter, they're much more mature in English than they are in Spanish. And so this is a big challenge. It would be fantastic for people who are interested in this area to collaborate. I hope I'm answering the question. These are two areas within the large project where you can participate, and this might help others as well. Thank you, Cristian. ¿De dónde eres?
Sí, sí, lo entendí, profe. Soy de Ecuador.
Perfecto. Listo.
Gracias.
A ti.
Questions or comments?
We have architects, designers, we have biologists, we have engineers, so don't be shy. You can be from, any of these areas. What we value the most, when it comes, for example, when we discuss the mathematical modelings, the results that they have, they're fantastic, but they don't look nice. We need people who are creative, who can showcase this differently. Just providing a picture, of how the peak behaves, for example, the curves of the number of cases. These are static, and this is a very dynamic phenomenon. So we want people who can think of this in a dynamic way. It's not just people who can do the stats or the math. It's a mixture. My background is in anthropology, so I have the social science approach as well. Any other brave participant that would like to ask questions?
Yeah, that was exactly one of the questions in the
Okay,
chat.
good.
If someone from social sciences can participate in the project.
Yes, is that in Spanish or in English? Should I go? Okay, I can't see.
It's in
Yeah,
Spanish.
yeah, okay. Well, I'll do both. I'm a social scientist, and the whole group of objective number 1, they're all social scientists. These are anthropologists, psychologists. They all have great experience on qualitative research, but they're also learning. And we're conducting interviews. We're doing focus groups. Many of these are online, so you could participate online. You could also participate in the analysis. You could also participate in very special sessions that we have with a health observatory here in Colombia called Así Vamos en Salud, and which is a partner of ours for the project COLEV. And this is a big technical table where a lot of decision makers, people with a lot of experience in the health service sector in Colombia, former health ministries, for example, and they act as advisors to us. So we have very interesting discussions where we just put ourselves out and we show them the information and we literally ask, does this make any sense? Does this help at all when you want to make the decisions? Because from the academia, we just think that everything we produce is useful and nice and clear. And that is not the case. So we have this, you could also just be a participant, you know, an observer of how these meetings are conducted. And there's no official program, but I think we should have something called like political epidemiology, you know, like political, there's a lot of lobby that you need to do to put this information out and hopefully to, you know, translate it into something useful. So we need social scientists for that. Sí, muchos científicos sociales. Absolutely.
There is another question. Do we need to be tech savvy for the internship, or we can contribute with analytic or visual skills?
Yes, no need to be tech savvy. we have those on board already. You could learn from them or ignore them completely. Not all of us, for example, and this is going to be ironic, we're studying Twitter, but I don't have, my Twitter account is not active, or my Facebook account. It drives me crazy personally. I like it as a subject of study, as a social phenomena. But you don't need to have, you know, you don't need to be part of a social network. You don't need to be using very sophisticated statistical packages. No, there are many ways of, you know, contributing, collaborating, and we can use, of course, analytic, either on a qualitative or quantitative, you know, side of it, and visual skills. Not sure what you mean by this, but yes, of course. It's a very large project, so we have a lot of things going on. We meet every Monday. For example, we have a large meeting Mondays afternoons. You could participate in some of these meetings, but we have our like, just like here, we have our own breakout rooms depending on the objective. And if you decide to join us, of course, you'll have meetings with me and with part of the group, but there are also other faculty leaders. So the webpage, you can see the rest of the team. And that would be good for you to see. I think that information should be updated already. Let me have a look if it loads. Yes, good. So this is Alf. Alf, for example, he's like my right hand, scientifically speaking, for the project. He's a physicist. He's a mathematician, and so you can see the contrast. Anthropologists and mathematicians working together. We need to think of this from very different perspectives. Andrea, she's a faculty member of the engineering department. She's timing the vaccination process. She's trying to figure out how long it takes for people when they start, you know, the queue, when they're online, and how long, and where we have these bottlenecks, and how can we make the process better. Andres Burbano, He's cineasta. He's a filmmaker. He works at the School of Architecture and Design, and he's the leader of objective number 5. So he's the one working on this algorithms, trying to do the analysis of the misinformation, constructing that database. But he's very creative. Ciro Amaya is from the School of Engineer. He's a logistics expert. Juan Carlos Rodriguez Raga, he is an engineer who hides within the social sciences faculty, and he's one of the directors of the Observatory for Democracy. They collect data across Latin America, and they're key partners in COLEF through objective number 4 and 5. So those studying the, the social media conversation and the disruptive communication strategies. Juan Manuel Cordobés, he's a biologist. He's the leader of the mathematical modeling group. He's a vice dean of the School of Engineer. Nubia Velasco, she is an engineer. She works at the School of Management, and she leads the group that is working on the logistics. Simon, no picture yet. He's in the School of Management. He's a social scientist. He leads group number 1. Nicolas is currently studying in Chicago. He's doing his AI studies there. He's a former student of mine. He's leading objective number 4, and he wrote with me this proposal. Fantastic person to get to know. Ángela María Mora, she's a student at the School of Faculty of Architecture, and Design. She works on visualization, data visualization. Camila is also a student, the School of Management, working with the logistics group. Diana Guerra, for some reason, is not showing the picture, but she's our what we call our scientific manager. So she helps me coordinate all the groups. And Stefania, Isabela, as you can see, I mean, the list is long. Engineers, mathematicians, she's an anthropologist. He is our project manager, Mauricio Cortez. He's a dentist. He's currently doing his PhD studies. And well, I hope that helps, so you don't feel that you are in the wrong place. It's a very diverse group. Maybe this here in Contacto, you can find our email address, the names of some of us, but we have your contact information. So we will be emailing you, and we will be using the forms questionnaire to gather information from those who decide to apply.
There is one more question.
Yes.
About the profile you're looking for, if it's for undergraduate or graduate students.
We actually, we can do both. I mean, currently as part of our team, most of our students are graduate students, but we have 2 undergrad students collaborating, one in the design area and one of the students that I showed from the School of Management. So perhaps it would depend on the scope of what you want and the time that you have that you want to dedicate to the project. But we have learning, opportunities for everybody across all levels. Nothing is too little or too big or too, no. Thank you, Lucas, for your comment. It's Portuguese. Lucas.
I think Lucas wants to say something.
Yes.
No, lo siento que no hablo mucho español, entonces yo tengo que preguntar en inglés. I'm always a little ashamed because I live in Latin America and don't speak proper Spanish, but we Brazilians do this all the time. No, I understood that the project is very interdisciplinary, and I'm under the impression that you guys don't have like what would be our day-to-day work during the project. That this would depend a lot on the profile of the admitted students. But is there do you have some idea of how would it be? And I mean, it's 20 hours a week, right? So what are you anticipating? I think that's my question, and thank you for the presentation.
No, thank you, Lucas, for asking. That, of course, is a very good question. It would really depend on what you would like to do and learn, because things are very different, you know, in between objectives. So, for example, group number 2, they're working on the model specifications, you know, all the time, and they're running models and they produce results on a weekly basis. So day to day, they input new data, they have their servers running, and Mondays they go check and have a look and see how things are looking. But they have to interact with those who want to visualize that information, and those they won't be working, you know, on any data specification. They're trying to be creative and finding out ways of how to showcase this information, you know, and not only with images, but also in words. So they would be using nice design software, creating, you know, prototypes, ideas, or even writing text. Group number 1, who are conducting the interviews, well, they would be working on analyzing those interviews, conducting more interviews, and literally like drawing as if this were a building, you know, trying to understand the architecture of how decision making takes place when it comes to COVID-19. And so this would, if you could have like conceptual framework, you would need to try to put in, you know, the different like little balls, like this is the Ministry of Health, but this is the health secretaries, and this is academia, and this is the media. How do they interact? You know, who has leverage here? So it's analysis of the interviews, but also I think reading a lot, watching media, like understanding the context and having a comparative perspective. It's very important to have a comparative perspective. You understand things when you are able to compare them, you know, to a different context. So how has the conversation taking place when it comes to social media in Brazil compared to Colombia? What is similar? What is different? And that would enlighten our understanding of Colombia as we compare ourselves with, for example, Brazil or another country. How strong or not are decision makers? This is a very, you know, political issue. It is a political thing. Obviously, it is health. Anything related to health and education is political. And we've invested very little in Latin America. And I think we're paying a big toll for that. And I'm sure it's something that has happened, of course, in other contexts. Group number 4, you literally have to become a Twitter and Facebook fan. They're running the algorithms. That's all they do. And they have Mondays, they usually present a summary of what was like the conversation about the previous week, not about everything, but things related to COVID. We select some topics, we write down things to use on our Twitter account. We follow some big trenders, and we see who they contact, how they react. It's very interesting, but in Twitter it's much more important to see who retweets than who tweets. And they're trying to understand that on a daily basis. So it's very different activities. And number 5, they're thinking about the intervention. How can they use the Museum of Disinformation as a tool to have pedagogic activity within schools? I mean, it would be very interesting to learn how kids in school react to this. So we would need someone to think about that, you know, the interaction of that museum, if we could think of other rooms for that museum, what would it be? And I would like to have, this is an idea we have with the group, and I'm just putting it out there. What have we learned in this past year? So we have a year of misinformation in Colombia. We could have a year of misinformation, you know, in Brazil. and see how it compares. We may have exactly the same, kind of of things going on, but mental health here is critical. And we are overwhelmed with the sufferment of, with all the people that have died, with the social cost and so forth. And I think it would be very great to be able to have something that provides hope as well. What have we learned? And I think that we've learned, speaking from my side in academia, that we can collaborate. That open access can be a reality. We need to share data. We need to share our information. Vaccines would not have been possible if people were not willing to share, 10 years of development of a technology. Understanding the phenomena is critical to use all the available information. And we still have a big lobby to push forth in terms of data access in Colombia. And I don't know if that's the case in Brazil, but I'm sure statistics are not perfect, and mortality, and vital statistics in general lack critical quality issues. So things like that. And we're happy to listen to your ideas. I'm just like giving you an overview, but it's just so much that we could try to replicate some of the things we're doing already within your own context. That could be, you don't need to start from scratch. We could just try to see, how does this look if we use data from Ecuador? How would this look if we could find data from Argentina? That the comparative perspective is key here.
Maybe more questions? If not, I think we can finish the meeting. We will be sending to your emails all the information and instructions for applying, including the form, so don't worry, it will be sent. Thank you so much for your participation, and we wish you a lot of success with the application.
Thank you all. Thank you for listening. We'll be in touch.
Gracias.
A ustedes, muchas gracias. Que estén muy bien.
Gracias.
Obrigado. Gracias, Caro.
Con gusto.